So this is number 10 and 11, the upper left lateral incisor and cuspid. And I'm going to do the endodontics on those first. So you can see 11 is about 23 millimeters and 10 is about 14.5 millimeters. So always, if you're doing something that could be painful, always give intraligamental anesthesia. You can watch these videos on how to do it. You want the bevel turned toward the tooth. I've already given an infiltration, so the tissue's numb. Now I'm profoundly numbing the tooth, and this is Sit-Nest 4% plain without vasoconstrictor. If you use vasoconstrictor, I've found it can cause ulceration in the tissue, and so I don't want to do that, use that for an interligamental unless I'm extracting the tooth. So again, the bevel toward the tooth. So I'm now going to perform endodontics on these teeth. The pulps were not exposed, but I want to get the internal retention, and I didn't want the teeth to be hypersensitive or abscess after we place the bridge. Thinking I don't want to have to cut through that bridge and do endodontics later, and I want internal retention on those teeth since they've been broken off. So that's why I'm performing the endodontics on these teeth. You should know how to do good endodontics though. This is a real world endo technique which we taught at my teaching center for 20 years, and it's a fabulous rotary drill endo method. This is a scalp file that you start with just to establish patency to within 5.5 millimeters of the apex. Now irrigating with a 30 gauge syringe. Now in this case, some of you are going to say, oh, you didn't use a rubber dam. Well, what is the point of a rubber dam? It's not necessarily to use a rubber dam. You don't want the patient to aspirate a file, and you don't want the sodium hypochlorite solution to leach out into the patient's mouth. So if you can isolate the mouth with another method like 2x2s, lots of 2x2s, and this patient's sedated, I didn't want to mess up the gingival tissue around the teeth with a rubber dam clamp because it's in the aesthetic zone. You know, just a lot of issues there. So that's why I'm doing it this way. You may disagree with it. I usually use a rubber dam anytime I can. This was just one of those cases. I felt like this was the appropriate way to perform the endo. So first, I'm using a headstrom file. First I use the scalp file on the drill to establish the length. Then I'm using the headstrom file and establishing and determining the exact length of the canal with the apex locator. So here we've written it down, irrigating with 3 parts water to 1 part sodium hypochlorite. This is a 35 rotary file after using the headstrom file to clean it out. All right, so whenever you get into these larger files, they're the ones that are most likely to separate. And I could count, since I've been using the rotary technique for probably the last 25 years, I could count on 1 or 2 hands how many files I've had separate. It doesn't happen very often, but it's going to. So you want to be really careful to not put much pressure on the rotary drill, and to be sure you get it cleaned out and irrigated in the beginning with the headstrom file. So this is a 35, you can see it's a green, and I'm just putting light pressure. It's kind of like you hold a golf putter. They say hold it like a baby bird. I'm just barely putting any pressure until it catches and then coming back up. Now this is a XP3DS. You can supposedly do the entire endodontic procedure with this roller coaster looking XP3DS. I want to clean it and irrigate it really well, but I'll use this XP3DS and that'll get it to about a 30, but I like to chase it with a 25, a 30, and a 35 if it's a smaller canal. So I'm irrigating again with the 3 parts water to 1 part sodium hypochlorite. Hello, this video is a small portion of a complete comprehensive video. If you'd like to see this complete comprehensive case and many other complete comprehensive cases, click on the link in the description below. It's what I use. As I said, some endodontists and some people use straight sodium hypochlorite. Some people use other things to irrigate the canals. The main thing is just clean them and irrigate them really well in case you had a separated file. Hopefully you never will, but you probably will at some point. And like I said, don't panic if you've cleaned it and irrigated it well. So I'm trying the gutta-percha cones in on 10 and 11. We take a radiograph, and this one's a little short, and this one's a little bit long. That one's that little short, and that one's that long. So I write on the sheet, this one is a little bit long. I want to take 2 millimeters off of that one on number 10, and I want to go 2 millimeters deeper into the canal on number 11. So I'm cutting 2 millimeters off of number 10, then I'm going to go a little further into the canal on number 11. I'm using this file to go a little bit deeper into the canal, irrigating. So I irrigate with 3 parts water, 1 part sodium hypochlorite. Then I rinse that out with local anesthesia in a 30 gauge syringe. Now many of you ask me, what type of local anesthesia? It doesn't matter. There could be water in the carpule. The key is the 30 gauge needle fits perfectly into the orifice of the canal without putting pressure to drive anything down the canal. It just rinses out a final rinse of any debris, and it also rinses out the 3 parts water to 1 part sodium hypochlorite. So I'm rinsing it out so it's just nice and clean. I'm going to try see, this is perfect now, right at the apex of both of them, or a little bit coronal to the apex. In a perfect world, the gutta-percha cone goes to about 1/2 millimeter of the apex. I'm irrigating it with the local anesthesia in the 30 gauge syringe. All right, so what I do then is I just blow some air, not hard, in the coronal part of the orifice to blow the volume of water out of the coronal part. Then I dry the canal. And normally, if I file it to a 35 or 40, I'll use a 35 or 30 paper point. And I usually use 2 paper points in each canal. You'll see when they first go in, they'll be wet on the end, and then it'll be dry, the second one. I want it to be dry. Now this placement of the sealer is an interesting point. Some of the endodontists applied the sealer into the coronal part of the canal, not pressure all the way to the end of the canal, because that might prevent the gutta-percha cone from seating all the way. But some of them just squirted some in the coronal part of the canal and then moved it into the canal with the gutta-percha cone. Others squirted the sealer on the gutta-percha cone and placed it. Either one works just fine. So I'm moving it up and down a little bit to get it into the canal. Then I'm cutting the coronal excess off with a burner, and then I'm plugging it with one of these pluggers. So this was a phase I was just squirting it on the gutta-percha cone. I think an easier way is just to squirt some into the coronal part of the canal, not with pressure, just squirt it into the top couple of millimeters of the canal, and then take it down with the gutta-percha cone. Then using the burner to cut that coronal part off, then plugging it with the plugger. So that looks good. Okay, so I'm doing the intraligamental injections on number 6 and 7, the cuspid and the lateral incisor. So the lateral is 16 and the cuspid is 24.5. I'm using a 330 carbide burr to open into the canal. Now at this point, I'll usually do an injection with the local anesthesia in the 30 gauge syringe into the exposed nerve of the tooth, just to be sure everything is dead, dead, dead. You don't want somebody feeling anything when they're having endodontics. That's the Dental Minute. These techniques work, and they work every time.
Are you feeling stuck? You know you have more to offer and you can elevate higher in your dentistry practice, but you just don't know how to do it? Well, great news. DentistryMasterclasses.com is here for you. At DentistryMasterclasses.com, Dr. Cutbirth is offering his greatest work and his best cases. Here's everything included when you subscribe to DentistryMasterclasses.com. You will get incredible comprehensive cases not seen in Dental Minute videos, an organized library of all the Dental Minute videos, and the Dentistry Masterclasses, comprehensive cases for study and reference. You will get before and after pictures of Dr. Cutbirth's fantastic restored cases. And guess what? All of this is $40 a month. That's right, $40 a month. This is an opportunity you cannot miss. Go to dentistrymasterclasses.com and subscribe today.